We're standing outside one of the rooms in the intensive care unit. We're about to see a patient who had a severe pneumonia causing his oxygen levels to be very low to the point that he couldn't breathe on his own and get enough oxygen into the blood. He had to have a tube put down his throat called an endotracheal tube, and he was then hooked up to a breathing machine called a ventilator. With this machine, we're able to give higher concentrations of oxygen to get the oxygen level to the appropriate place in his bloodstream. And we're going to go in and take a look at the ventilator and some of the other monitoring equipment around him so that we can understand how we use partial pressures to actually take care of patients who are sick in the intensive care unit on a daily basis. This is a standard ventilator, the breathing machine, if you will, that pushes air into the lungs, and then the air just comes out automatically as the lungs recoil. So this ventilator, the breathing machine, is hooked up by these tubes, ultimately to a tube that goes into the patient's throat or trachea. You can see perhaps that there is water droplets within the tube because the breathing machine, the ventilator, warms and humidifies the gas. Normally our upper airway, our nose and our throat, warms and humidifies the gas before it gets deep into the lungs, but since the tube in his throat is bypassing all of the upper airway, we need to provide the moisture and the warmth from the machine itself, so it's not a drying effect on the lungs. If we put dry gas down there, we would actually suck out quite a bit of water from the lungs. This first number up here, 50, tells us the percentage of oxygen in the gas that's being pumped into his lung. So he's receiving 50% oxygen. We've talked before how just all of us breathing oxygen from the room air is about 21%. So already he's getting more than twice as much oxygen in the gas that's being pumped into his lungs. And this is to make up for problems at the level of his, what we call the gas exchange, or the level of the air sacs or alveoli in the lung and the capillaries. So he's got 50% oxygen going in there, and his partial pressure of oxygen, which we've talked again about, is about 75 this morning, and that's getting 50% oxygen. So all of us walk around, if we're young, healthy people, with an oxygen level, a partial pressure of oxygen in our blood of about 90, 85 or 90, and that's breathing 21%. So you can see that he clearly must have some problems with his lungs if with getting 50% oxygen, his partial pressure is only in the 70s. A normal person getting 50% oxygen, they'd have a partial pressure in their bloodstream of oxygen of about 250 or so, but much, much higher than what he has. So we're now at the bedside monitor for the patient, and we are looking at some other data that we keep track of on a regular basis, moment to moment. The third level here is something called the oxygen saturation. We talked about the fact that oxygen moves from the alveolus into the liquid portion of the blood where it's dissolved, and then moves from the liquid portion of the blood onto the hemoglobin and binds to sites on the hemoglobin specific for oxygen. And this number, 98%, is telling us the percentage of binding sites for oxygen that are actually occupied by a molecule of oxygen. This is normal. We like to keep it above 90% in order to ensure that we're delivering an adequate amount of oxygen to the tissue. But remember that he's receiving 50% oxygen in order to achieve 98% saturation. A normal, healthy person could get a 98% oxygen saturation just breathing air from the room, which has 21% oxygen. But this number, the 98%, again, is telling us about the partial pressure of oxygen in the lung. It is a rough correlate with the partial pressure and allows us to get moment-to-moment measurements, whereas the partial pressure requires that we actually get a sample of blood in order to get that determination. When we examine patients, we also look for clues about oxygen levels and the way that oxygen is being delivered to the tissue. We can look at someone's hand as an example and look at the nail beds on the fingers. Normally they should be nice and pink because oxygenated blood tends to be pink or red. So that's telling us that there's a good oxygen level coming into the fingers. A term called cyanosis is a bluish coloration of the fingers, sometimes also seen around the lips, that can be an indication of a low partial pressure of oxygen in the blood. We also can look at the feet where we look at things like what's called capillary refill. So here we're looking at the foot and the toe, and you see that the skin is nice and pink, again, because there's good oxygen being delivered to the tissue. When I push on the toe, the skin becomes white because I'm compressing the small blood vessels or capillaries, pushing the blood out of them. And then I look to see how long it takes for the capillaries to fill again. This is quite brisk in him within a second or two. That means that the amount of blood being pumped by the heart is quite normal, bringing oxygen again back to the tissues well. Now remember, he does have a good partial pressure of oxygen in his blood, but it's requiring 50% oxygen being delivered to the lungs in order to achieve that because of his pneumonia. I hope you've had a chance today to see the concepts you've been learning about partial pressure, the movement of oxygen from the alveolus into the blood, the liquid part of the blood, and then onto the hemoglobin, and the relevance of that for taking care of sick patients in the intensive care unit, as well as some patients who are actually ambulatory as well. But this gives you a sense of the importance of these core concepts and the application in a very real way to the management of our patients.